Our next speaker will be approaching dietary fiber from a regulatory perspective. Stuart Craig of DuPont will cover that. What we're mainly want to look at here is, as we know, the Codex definition requires judgment as left to national authorities. The proposed U.S. regulations are going to require judgment in particular cases. Obviously, what we need is some harmonious processes, but at the same time, we're going to have to maintain some balance by having flexibility. Stuart?
Thanks, John. So first, let me say to all of you, congratulations, making it to the last presentation, and I have some very good news for you. I only have 2 slides. I tried to get it down to 1, I really did, but it's 2, so I apologize for that. And then the rest of it is really up to us, and really the main point of what I want to do is get us to have an engaging discussion. And so I'm here because I'm the chair of the dietary fiber subcommittee on this ILSI carbohydrate committee, and I think I just would preface this by saying that based on the comments we've had so far, that I think we've come a long way since the last Vahouny. I know there's been some comments about worked in dietary fiber for 20, 30, 40 or more years, and some of the same issues are being discussed. But and I would also say that the last I'm hoping that this discussion that we have will be as helpful and insightful and useful as the last discussion that we had that was sponsored by ILSI, which at that time led to the publication of a paper based on some voting that we had about the DP 3 to 9. We also came up with, as is now being called, the Vahouny 9. I think we do have to be careful, to Fred's point. When we think of those 9, they came up from this discussion. It was, tell us what you think are some physiological benefits that are associated with dietary fiber, and from that we made the list. We put them all together. We put them in the other section of that poll, and then it was part of the paper that we published. I think it's important because when you think of where we have come from with the Codex definition, with Health Canada's definition, and now FDA's proposal, that is a long way in 4 years, and the discussion that we had at Vahouny has helped along that way. So, with that said, this is the main slide. The other one's a supporting one that I'll just touch on. But I tried to put, maybe not all, but many of the key discussion points that we might want to go through. And with apologies to Europe, Vim covered that very well, but I don't have that up here. I also don't have Australia, New Zealand. I don't have the original ACC, but I couldn't get everything on one slide. So what I did was I thought, let me compare FDA's proposal with what Health Canada has and also Codex. So let me go through them. Looking at what goes on the food, you can see that in each case, the idea is to have one thing on the food label. Keeps it simpler for consumers. Underlying it might be added functional novel fibers that need some data to support their physiological benefit. But in terms of once you get beyond that, then it can be put as one thing on the label. So good harmony there. Degree of polymerization, PP 3 or greater, and 10 or greater, but 3 or greater as a decision by national authorities. And that was also well discussed earlier. So I would view that as, again, good harmonization across. Whether isolated and synthetic non-digestible carbohydrates should be included. So yes, and the FDA's proposal is, I've called it positive list just for the sake of keeping it simple, but you would have a petition review and you would be on a list. Health Canada, of course we just edited this slide, and I have to thank Courtney for all the help that she's given in putting all of this together. Positive list, it's really, you have the option of doing that. And Codex definition also suggested that isolated and synthetic non-digestible carbohydrates should be included. About methods. So we've had some good discussion about that, and yes, these methods would be could be used. However, we may need to subtract some ingredients that have yet to be validated. And again, good harmony across here. Caloric value. Are some differences here. Proposal of soluble to be 2, insoluble to be 0. Health Canada also says 2, but not just for soluble, for all. And they do highlight that lower values that may be can be allowed if there's good substantiation. And this was really not discussed in Codex. And then finally, the physiological benefits. Not really specified here. However, stated as physiological physiological effects beneficial to human health, with reference to IOM, such as attenuation of postprandial blood glucose, blood cholesterol, and improved laxation. In Health Canada, it's very similar. What I've called a non-exclusive list, which has the laxation regulation bulk, the lipids, the glucose insulin, and then also what we've been discussing is the addition of colon fermentation. And then finally with Codex, again not specified specifically, but physiological effects of benefit to health as demonstrated by generally accepted scientific evidence to competent authorities. And just as a reminder, when we do talk about the physiological benefits, in more in the exact wording for Health Canada, these are the 4 and the infamous Vahouny 9, and clearly some of these could be are combined in so for instance improved laxation or regularity by increasing stool bulk. Well, you've got bulk laxation here, you've got transit time here. Could be that some of them are really ought to be grouped together. I thought about we talked about regrouping these but these are exactly how they are in the paper, so I thought I'd just leave it at that. And so that's it for me. We'll come back to that. John will go forward. We'll come back to that summary slide, and we can use that as a springboard for discussion.